Welcome to Fun with ECGs. "30 seconds to look for evidence of ischemia." So the standard ECG parameters are here. I hope you went on to spot the widespread 3 millimeters of extensive ST depression, which is spread throughout the inferior, lateral, and even some of the anterior leads. We see what could be early repolarization or high takeoff in V1, V2, but I would be concerned about in this situation. We have voltage criteria for left ventricular hypertrophy, but LVH secondary to strain should really be more limited in its extent. I'll be showing another ECG of that in another series. And I also wanted you to spot for me the ST elevation in AVR. Remember, AVR looks at the heart from the top right. If you hold your right arm in the air, this is looking at the heart from that direction, and it tends to be inverse of the other leads. But this can be a sign of left mainstem disease or very, very proximal LAD disease, and is a very concerning feature when seen in the ECG. Now, purists will tell you that AVR is simply the negative of the sum of 1 and 2 divided by 2. What does that mean? Well, if you take lead 1 and you take lead 2 and add them together, you get a larger complex retaining the ST depression here with a bit more R wave. You then divide that by 2 to get a half size of the complex, and then you invert it. You multiply by -1 to do the negative, and you get something which looks identical to AVR. So this isn't actually an independent lead. The only independent leads of the limb leads are 1 and 2. The other limb leads are all made up just by combinations of these two leads. But nonetheless, in practice, it can be very useful to look for elevation in AVR as a sign that you've got very extensive coronary artery disease going on. Now, this patient is a very concerning, unstable patient. You should manage this patient as per a STEMI. They should be immediately looked at having primary percutaneous coronary intervention. You wouldn't be able to thrombolize this patient because they don't meet criteria for it, but this patient has got a very great deal of myocardium at risk and needs to go straight to the lab for investigation. Thanks for watching.